Schizophrenia is considered to be one of the most debilitating mental illnesses. This short video will briefly describe the signs and symptoms of schizophrenia, the effects they have on everyday living, and how occupational therapy can help this population to function better in society as well as managing their own personal life. People with schizophrenia will experience 5 symptoms. These symptoms are delusions, hallucinations, disorganized thinking, disorganized behavior, and negative symptoms. Delusions can be described as either bizarre or non-bizarre, and hallucinations most commonly are auditory. However, they can affect the person's sight, smell, taste, and touch. Disorganized thinking is characterized by an inability to follow a conversation or explain the person's thoughts, or being easily distracted throughout conversation. Disorganized behavior is described as socially inappropriate behaviors or those that poorly impact their ability to complete their daily activities. People with schizophrenia demonstrate a lack of motivation and emotional expression, as well as an inability to read other people's expressions and emotions. These symptoms are called negative symptoms, meaning that something that is normally present is absent in those with schizophrenia. Occupational therapy has a primary focus on activities of daily living, or ADLs, which include bathing, grooming, dressing, and eating. Instrumental activities of daily living describe activities that are necessary for ADLs, however, not the basic tasks, such as grocery shopping, preparing meals, and doing housework. These tasks are often impacted when someone is suffering from the symptoms of schizophrenia, such as depression, anxiety, and a lack of motivation, also called anhedonia. People with schizophrenia often struggle to attain and maintain a job. This is likely due to the significant rate of people with schizophrenia who do not receive their high school diploma, as well as the person's inherent difficulty with maintaining good social relationships, as well as executive functioning impairments. In order to have a successful work environment, it's helpful to have structure in regards to task and flexibility in regards to due dates for work, as well as time commitments such as being part-time or full-time based on their scheduling. The access to a coaching relationship is also important to assist in familiarizing the person with new and unfamiliar tasks. As previously mentioned, the emotional impairments associated with schizophrenia negatively impact the person's ability to create bonds due to difficulty reading people's expressions, as well as paranoia and delusions. People with schizophrenia also are less likely to pursue physical activity for leisure, have limited access to transportation, and less financial resources to participate in social outings. These factors can lead to a feeling of social isolation for people with schizophrenia. Primary client factors that are impacted by schizophrenia are cognitive factors such as memory, planning, sequencing, experience of self, and thought. Ultimately, occupational therapy's unique scope of practice can assist a person with schizophrenia with creating a routine, looking at the person as a whole rather than their disorder, and adapting their environment to maximize function and occupational participation.